Geography and You presents.
Hello and welcome back to the GNY live podcast series on the air we fear. This is your one stop destination for conversation about the most critical issue of our time, air pollution. I'm your host, Dr. Sumiti, joined by Dr. Shulagna Chattopadhyay. Well, air pollution isn't the most entertaining topic, but considering that it impacts every breath we take, it's time to act on it the best way we can. So, today we are conducting the second podcast of the six-part series and have invited a special guest, someone fighting for clean air, Dr. Arvind Kumar. Dr. Arvind Kumar isn't just an eminent pulmonologist, he's a warrior for healthier lungs. Chairman of the Institute of Chest Surgery at Medanta Hospital, Dr. Arvind has built two pioneering initiatives, the Doctor for Clean Air Movement and the Lung Care Foundation. Dr. Kumar, thank you for joining us today. We are so happy to have you on the show. How are you doing, sir?
I'm good, and thank you so much for inviting me on this very prestigious show. It's indeed an honor for me to be a part of this show and share my experiences with your wide audiences across the globe. It's indeed an honor, and thank you so much once again.
Thank you, Dr. Kumar. Over to you, Dr. Shulagna Chattopadhyay.
Thank you. Thank you, Dr. Sumiti. Doctor, my first question to you is do you we heard yesterday you were in a difficult surgery and you have many such difficult surgeries lined up. Is it the time of the year where you are seeing a larger, what is your experience with the larger number of diseases related to the lungs, diseases related to the heart? What is your understanding of the season? Is it seasonal? What do you think?
It's actually a very wide question, and maybe 24 hours may be a short time to answer this question. Nonetheless, I'll try and answer it in just a few minutes because you've encompassed almost everything. That okay, what are the ill effects? So before I answer that question, let me go back into my past. I'm a chest surgeon, and I have been operating on people's chests since 1988. That's almost 36 years plus. And I open 2 to 3 chests every day as part of this my profession. That allows me to look at people's lung, and it also gives me a timeline as to how things have changed from 1988 to 98 to 2008 to 2018 to current day. One of the major differences which I have seen, which is shocking, and I'm sad to be discussing it, but it has to be discussed because it's true and it needs to be told, is that I don't see pink lungs anymore. When we are born with pink, pristine lungs. That's what God gives us. Nonetheless, because of pollutants going into our lungs from the very first breath of our life, I'm seeing black deposits in the lungs of people. Initially, I used to see it in smokers and I used to see pink lungs in non smokers. But over the years, I started seeing black dots on non smokers also. And my most shocking moment was in around 2012, 13, 14, where I saw a series of teenagers with black dots on their lungs. And that horrified me. Yes, that if the teenagers are having black dots on their lungs in at this age, what will happen to these lungs by the time they are in 30s, 40s, and 50s, if at all they'll reach that age? And that's what moved me, that should I remain quiet with this information, keep it to myself and keep operating, or spare some time out of my schedule, come out into public space with those images and share them with people. And with that aim in mind, in 2015, we set up Lung Care Foundation. with the specific goal of sharing this information with people and telling them how there is a silent bad revolution which is going on inside their body, the effect of which is not confined to the lungs alone, because we know that these deposits, they enter through the lungs, they deposit in the lungs, but thereafter they release their chemicals which enter the blood system and enter and reach every organ from head to toe. Wherever the blood reaches, these chemicals reach. So they have their deleterious effects on every organ from brain to toe. And when I knew about it, when I learned about it, I started looking for these in the society, in my patient groups, and amongst other people. And I was horrified that actually these are all occurring. We are, as doctors, we are seeing them in our day to day practice, but somehow they were not getting linked to the air pollution. And that's where I thought that since air pollution till then had been projected as a chemical issue, and I said, no, it may be a chemical issue to begin with, but in terms of damage to the population, it's a pure health issue. And who better to talk about health issue than us? And that's why within Lung Care Foundation, we set up a separate vertical called Doctors for Clean Air. Any doctor who feels moved by this issue is welcome to join. And we have hundreds of doctors from across the country, cutting across various disciplines, who have been made part of this. Aim is that every doctor, when he writes a prescription and sees that this disease is likely to be linked to pollution, he mentions it to the patient so that all 140 crore people of the country are aware how badly the pollution is damaging them, because then only the effort towards solutions will emerge, which we'll discuss towards the end of this podcast.
Right, that is extremely a noble. The ideas are so very noble, and I hope that I'm sure you're impacting the people. At least making them aware about how things can be bettered, or maybe we'll, like you said, we'll come to that part later. But yesterday we had a conversation with a scientist. He was a former DG, Director General of IMD, Dr. KJ Ramesh, and he was telling us that the effects of air pollution, it is not immediate. I mean, you don't feel it right away, but it takes about 10 years. I mean, you can have the impact even 10 years later. How correct is that?
Yeah, so effects are immediate, intermediate, and long term. All the three
Okay.
are there. And when does it start? So the air pollution enters our body mainly through our breathing system. Although skin is directly exposed, nostrils are directly exposed, eyes are directly exposed, hairs. So skin, hair, eyes, and nostrils. These are four areas which are directly exposed to the thing. So a lot of itching, allergies, red eye,
Mm-hmm.
burning in the eye, watering from the eye, sore nose, all these things we see, dry, coarse hair, hair loss, all these things are happening and we see them every now and then. But more toxic is the entry through the nostrils into the lung system. So we have particulate matter and we have gaseous matter. Now, the gases
Mm-hmm.
are in molecular form, they reach the terminal parts of the lungs. When it comes to particulate matter, the PM10 oftentimes gets trapped either in the nostrils or in the main windpipe or in the
Mm-hmm.
proximal airway. But the more damaging PM 2.5, PM 1, and PM less than 1, the submicron size particles, they reach
Yes.
up to the end of the last alveolus of the lung and
Alveoli.
they sit down there.
Oh, oh.
And once they settle there, they have a lot of chemicals adsorbed on their surface and they release all those chemicals, which then passes through the alveolar membrane, enters the blood, and through that it can go everywhere. Most unfortunate is that if this happens with a pregnant lady, these
Mm-hmm.
toxins pass the placenta and go to the
Oh,
fetus and starts
I
impacting
didn't know
the
that.
baby under preparation. If it's first trimester, when organs develop, you have
Mm-hmm.
all kinds of congenital defects. If it's second and third trimester, when the growth takes place, you have growth
Mm-hmm.
retardation, premature delivery, or even intrauterine death, or all kinds of problems after delivery. So, air pollution does not wait for us to be born. It actually starts impacting us even before we are born. Next part, a baby is born and he starts breathing. He's given to the mother and he starts breathing. Maybe first few
Mm-hmm.
hours we give extra oxygen. After that, the baby is on his own. So he breathes the same air which others are breathing. So today, if in Delhi the AQI is 300, PM 2.5 is 250, 300, which is often the case,
Mm-hmm.
the baby
Yes.
also breathes the same air.
Yes.
And we know that in terms of damage, 22 micrograms of PM 2.5 is equal to one cigarette. So if you have PM 2.5 of about 250, it's equal to 10 cigarettes in terms of damage. And that's why I dare say that in polluted city, the newborns start smoking from the first breath of their life in terms of damage. So the damage is
Mm-hmm.
starting in the uterus. It continues from the first breath of the life and it continues through the childhood, through the teens, and into the adulthood. And that's the reason why we are seeing impacts in young babies, in toddlers, in teenagers, as well as in adults. So there are some immediate effects which happen on the eyes, on the nose. And if
Mm-hmm.
you
Mm-hmm.
inhale too much of toxin, a lot of
Mm-hmm.
people develop breathing difficulty because
Yes.
the windpipe, the lining of the
Mm-hmm.
windpipe is very sensitive to these chemicals. They cause swelling and they cause immediate, constriction. So a lot of people
Constriction.
have a
So
choking
asthmatic.
sensation when they
Yes.
go to a
Yes.
polluted
Indeed.
area. Suppose you are
Mm-hmm.
exposed to a lot of smoke. What happens? You start coughing. Cough is a
Mm-hmm.
response of the lungs, that lungs want that chemical to get out. So it's coughing to get it out. And then it goes into spasm. A lot of people have asthma like tendency, they have to take inhalers. So it's
Yes.
wrong to say
Yeah.
that there are no immediate
Inhaler.
effects. There are a lot of immediate effects. Air pollution exposure is the commonest cause of death in children under 5 in rural areas because the little babies sit next to the chulha and they are
Mm-hmm.
exposed to massive levels of air pollution in that smoke which is coming out from
Indoor.
chulha, and they immediately
Mm-hmm.
develop pneumonia. So it's an immediate effect. Bronchospasm is an
Okay.
immediate effect. Coughing is an immediate effect. When you have your lining inflamed, it becomes more prone to infections. So these days, we are seeing a lot of old people who are otherwise fit, but having
Mm-hmm.
COPD coming to ICUs with pneumonias, much higher incidence today than we used to see
Okay.
about 20, 30 years back. That's an immediate effect of pollution exposure. There are reports that whenever there are spikes in the levels of
Hmm.
air pollution, in the next
Yes.
few days, you have higher incidence of people reporting with heart attacks, people reporting with brain attacks following. These
Hmm.
are all immediate effects. So you have a lot of immediate effects. However,
Yes.
there are
Uh-huh.
long-term effects also on various
Hmm.
organs from brain to toe. The most dangerous long-term effect is on the lungs because the maximum exposure happens there, where you have a disease called COPD. Now,
Yeah.
COPD, where the
Hmm.
lungs become weak, was initially considered to be related to smoking. But
Mm-hmm.
now we have a big group called non-smoking COPD, which
Yes.
is because of the other form of
Other.
smoking. And no
Mm-hmm.
wonder
Mm-hmm.
WHO has called air pollution as the second tobacco epidemic.
Hmm.
Why is it causing damage? if you go into the chemical composition of the cigarette smoke, it has more than 70 chemicals which cause cancer as well as damage the lining of the lungs and cause various problems. And if you
Yes.
look at the polluted air, you find
Hmm.
that a lot of same chemicals are present there also.
Composition.
So chemicals are chemical. They will cause damage,
Hmm.
whether it's going through cigarette
Hmm.
smoke or it's going through
Hmm.
polluted air, the effect is the same. And that's why people living in polluted areas are having the same problems which used to
Hmm.
occur in smokers, even though these guys are typically not smoking. But I always say that in a polluted city, there is no true non smoker. Everybody in a polluted city is a smoker if you look in terms of damage to the lungs.
Right. Right, doctor. Now, a couple of questions. One is looking at the kind of markets we have, but we will come back to that a little later. We read a report recently which said that Indians have a lower lung capacity as compared to people of, say, Switzerland or any other place which is less polluted. Is that a correct statement? Would we say that we have lower lung capacities?
So, one of the effects of pollution exposure since early childhood is a
Mm-hmm.
stunted growth of the lung.
Okay.
So, if you look at the people who are born and brought up in polluted cities and you
Mm.
compare them with others who are in a better air quality cities, it is said, and
Mm-hmm.
there are reports from many countries, including China and other countries, that it does lead to stunting of the lung growth. And there are also reports that it
Oh
leads to
my.
stunting of the brain growth by a factor of about 10. So there is a decrease in the IQ level by about 10 when it comes to
Oh.
the children born and brought up. So if you extrapolate that, well, it may be true that yes, the children born in polluted cities do not develop their optimum lung capacity as they would have developed otherwise.
Okay. Okay, that's really really sad, and it's quite scary actually. Um, Now, doctor, there are these new methods, people like detox and detoxing your lungs. So you go and you do stuff, and you do, I wouldn't name the procedures, but yeah. So you do stuff and you get your lungs detoxed, or your body becomes all clean. Is that a possibility? Because I mean, just we were talking about spots in the lungs. I mean, after the alveoli, where do these contaminants or these deposits really go? Is there a way out? I mean, can you clean your lungs,
Yeah. So there
detox
are
it?
smart people who actually are able to make out a business opportunity in just about everything. And so I'll bring you back to my initial statements where I said that these toxins go and get deposited in the lungs. I,
Mhm.
as a doctor and a chest surgeon, can tell you that anything which is deposited in the parenchyma of the lung becomes
Mm.
integrated in its wall and cannot be removed from there.
Cannot be
No.
removed.
So there are clinics, including many at the airports. Now there are oxygen bars at the airports.
Yes.
There are oxygen clinics, oxygen spas, oxygen bars, oxygen salons, so many of them
Mm.
in malls, airports, and places who claim that they'll give you 100% oxygen for 15 minutes for X amount of money and it will detox your body. As a doctor, I can tell you it has no basis, zero basis.
Hmm. Hmm.
We know that if we give 100% oxygen to our patients in ICUs or OTs, there is a
Hmm.
term called oxygen toxicity.
Toxicity, yes.
So these people are exposing themselves to the possibility of oxygen toxicity without
Hmm.
any benefit coming to them in terms of improvement in the lung, except psychological benefit because they have lied down calmly for 15 minutes. Somebody is playing some
Yeah.
soothing music for them. and money is being spent. So you feel, oh yeah, I'm very
Some
energized. It's all
yeah, something good
psychological.
must have happened.
It's all
Yeah.
psychological.
Yes.
I
Yes.
dare any one of these clinics
Hmm.
to do a randomized trial where they take
Hmm.
100 people, 50 people
Hmm.
are put in one room where they are actually given 100% oxygen, and other 50
Hmm.
are put in another room where they are told that they are being given 100% oxygen, but they are given pure air. And I can tell you,
Hmm.
when they come out, there will be no difference in the levels of satisfaction of both the groups. So it's working
Yes.
purely by psychology, no
Yeah.
scientific
Hmm.
basis for
No
these
science.
oxygen spas to help people detox their lungs. No.
Yeah. Thank you. That was very, very important because I think our viewers need to know this because now, we see these things out there visibly in front of us and it's very attractive, like you said. So that doesn't help at all. So just for our listeners, please don't go to these oxygen bars. They don't help you.
If you
Uh,
allow me, in the same breath, I can, because
yes.
in one of my other podcasts, I was asked a question that there is a company which is importing air from Canada in cans. And those
Okay.
cans are also selling fast, that okay, if 15 minutes every day, if you breathe, you feel better. Again, psychological. It's of no use. No
No
use.
use.
Yeah.
No use.
Just for one of your viewers.
Uh, Yeah, but we would come to the question of air purifiers, Doctor. And we would like to know about air purifiers and what would be your recommendation? How do you think that would impact our
You want
lungs?
me to answer it now?
Yes,
Okay. Right.
if you
Good
may.
that you asked the question. And linked with air purifier is another topic of masks,
Yes. Hmm,
because they go
hmm,
together. I'm asked this question
hmm,
every day. So let me first talk about the mask, because that's
hmm.
very easy and simple to answer. So this mask that I'm wearing, I use it during surgery. So this kind of surgical mask or a cotton mask has no
Hmm.
role in the prevention of your exposure to air pollution. So if I
No
wear,
role.
no, this mask, if I wear this
Okay.
surgical mask and I go to a polluted area and I breathe
Hmm,
through this mask and I feel that now
hmm.
I'm protected, no, I'm not. The one which
Okay.
protects is
Hmm,
N95 mask, because
hmm,
that is
hmm,
made
hmm.
of a special material where the pore size is such that almost 95% of the particulate matter is trapped, though gases still pass. So
Pass.
first
Okay.
information I want your viewers to know is that when you use N95 mask, you have to put it on the nose and you have to press that clip so that it fits snugly around the nose, and then you have to keep it around your chin so that all the air passes through the mask. No air should be passing from the side. Condition number 1. It should not
Hmm,
be torn or broken or wet, because in that
hmm,
case it loses its effectiveness. And number
hmm.
3, even if it's new, properly fitting, you are only protecting yourself from the particulate matter, the gases will still go. And last point, fourth
Yes.
point, this protection will last only as long as the mask is on. Wearing the mask for 2 hours does not protect you for the rest of 22 hours of the day when you are not
Hmm,
able to wear the mask. And I asked this
hmm.
question to people, can 140 crore people of the country wear masks 24 by 7 for next 10, 15, 20 years till we solve this problem? The
Yeah.
answer is no.
Impossible.
So when
Of
do I
course.
recommend it? I do recommend it when you are passing through a highly polluted area. There is a
Hmm.
lot of dust is there, a lot of pollution is there. If
Traffic.
those kind of
Hmm.
traffic is there, and especially if
Hmm.
you happen to be a chest patient, then you
Hmm.
please wear N95 and
Hmm.
protect yourself for the period that you are having the mask on. But one
Hmm.
very serious piece of advice, never exercise with the mask on. I've seen a lot of people running in the parks, doing jogging, doing
Yes.
cycling with the mask on.
Hmm. Hmm.
N95 has a lot of resistance because the pore size is very small.
Very
Even
tiny.
the air has resistance in passing. And if you do that, when you exercise, your body's oxygen requirement increases. You have to breathe
More.
faster. And sometimes you may not be able to deliver enough oxygen or CO2 because a lot of rebreathing is there. You exhale
Yeah.
and you inhale before the air gets out. So there is a rebreathing, so your CO2 levels may rise. So never ever exercise with your mask on. So this is about
Right.
the mask. Now coming
Yes,
to
but it's okay, doctor. But it's okay to wear the mask. The carbon dioxide, like you said, there would be saturation levels of
so it's okay
lower
to
the
wear the
saturation
mask,
levels.
but not when you are exercising.
It's okay to wear the mask, but not when you're
When you
exercising.
are
That's your
exercising,
mantra.
suppose you are running, you are cycling, you are jogging, whatever you are doing, at that time, if you have your mask, N95 mask on, then you may have breathing difficulties.
Difficulty.
So
Okay,
don't
sir.
exercise with N95 on. Otherwise, N95 does give you protection from particulate matter for the duration that you are wearing it. So a lot of times people make their children wear it when they are going to school in the morning.
School,
Because
yes.
that's the time when the highest levels of pollutants are there. But if you notice those children put on the mask when they come out from the house as long as mom and dad are there. The moment the bus starts, they take it here. So you will see that the nostrils are open and the mask is actually covering the chin,
hanging on their chins,
which is no good. So it's okay. It's a good temporary option, but not a solution to the problem of pollution. Now, coming to air purifiers, how does air purifier work? Air purifier has a motor which sucks in air from the room. It passes through HEPA filter, multiple layers, and then it is let out. And there is a recirculation. So the first requirement for an air purifier to be effective is that the air handling capacity of the motor must meet this criteria, the volume of the room. The HEPA filter should be of good quality, that it traps the particulate matter. And thirdly, the doors and the windows of the room have to be closed, just like we do for air conditioner.
AC.
If you have open space, air purifiers will not work for you. It will only help you as long as you are within that room. But if you move out of the room, the air purifier does not continue to give you protection once you are out of the room. So again, I ask the same question, that can 140 crore people of this country be confined to rooms and be provided with air purifiers in all the rooms across the country to clean the air? Answer is no, which brings me to the answer that air purifier as a solution to the problem of pollution, the answer is a big no. Having said that, does it have any role? Do I prescribe it? Yes, I do. It does have role for specific population. For example, all my operated patients, when I do lung surgery, I do lung transplant. So when I discharge my lung surgery patients, lung transplant patients, I make sure that they have a good quality air purifier at their home before I discharge them. Because in my hospital, I'm giving them HEPA filtered air. But when they go home, they need a HEPA filter in their rooms. So this is a specific population, those with chest problems, those where pregnant ladies are there, young children are there, you have very elderly people, you have people who have comorbidities, respiratory problems, heart problems, patients are on steroid. This is a group which has a higher chance of acquiring diseases if they are exposed to air. So this is a subset of population where on medical grounds, I recommend them that if they can afford, they get an air purifier. Another important piece of information about air purifier, which is never talked about by the companies, is that the filter, the HEPA filter, gets choked in due course of time. And how soon it gets choked depends on how much pollution is there.
Much pollution there
so
is.
typically, in about 6 months' time, the filter gets choked. And once it is choked, it stops cleaning the air. and the filter needs to be changed, which 99% of the people don't do because
Don't
it
do.
again
Yes.
costs money and the companies also don't insist on it. And mind you,
Hmm.
the filters are more expensive than the air purifier.
The
It's just like
machine. Yes.
printer.
Yes.
Printer is cheap, but
Yeah. Ink is
cartridge is more expensive.
more
So why
expensive.
I'm
Correct.
mentioning all this
Hmm.
that, madam, these are practical issues. I
Hmm.
know a lot of people who bought an air purifier, a small air purifier they have kept in the middle of the house, and they feel very safe. Oh, doctor, sir, I've got an air purifier. I am
Hmm.
safe.
Hmm. Hmm.
But it's a
Hmm.
false sense of safety that they have. It's doing
Yes.
psychological benefit, but no real medical benefit. However, if you buy a good quality, which has proper HEPA filters, and especially
Hmm.
nowadays, we have another technology where charcoal absorbing mechanism is also being provided. So that has a
Okay.
provision. So there is a, a model in which, apart from a layer of HEPA filters, there is a layer of charcoal. Now, charcoal
I
is a
see.
good adsorbent and it
Mm-hmm.
absorbs a lot of gases, VOCs, CFCs,
Hmm.
bacteria,
Hmm.
viruses on its surface. So, when you have
Hmm.
air passing through these multiple technologies, obviously the air coming out is much cleaner than a single technology. So, they do help, but only as long
Yeah.
as you are inside that room. The
Yeah.
capacity has to be adequate. The rooms, windows, and doors have to be closed. And when you go out,
Yes.
I'm sitting in my
Yes.
office. The air
Mm-hmm.
purifier, if I have one at home, is not giving me any protection now. So we have to remember it
Yeah.
only helps
That
during
every
those
space.
6 to 8 hours that we pass in our
Hmm.
bedroom. So, lastly, I would say that it is a very useful provision for people with specific disabilities or people with specific diseases. But should it be recommended as a solution to the pollution problem of the country? The answer is no.
No, definitely not. It's also, it's unequal because very few can afford it.
Very,
So
very
there
well
is an
said. I'm so
aspect
happy,
of,
madam, you made that comment because I always say that it creates a vertical divide between the haves and the
hmm,
have nots. The have
yes.
nots are more exposed and cannot
Hmm.
buy these technologies. The haves are less exposed and can buy it.
Hmm.
So it actually widens the gap between the two, which
Divide.
is not
Yes.
a good thing.
Yes.
Thank you
Yes.
for raising
Yes,
this.
doctor.
Yeah.
Yes, of course. Now, of course, you've been doing incredible work with your, the Doctors for Clean Air movement, and this is very rare, actually. And I'll have a little bit of discussion on that just after this question. This is my question to you: is that do you think you've been able to? Of course, you've been talking to patients. You have a lot of following. We know a lot about you because we've seen you've taken out time to do your your YouTubes, your podcasts, and all of that. So you really care. We can make that. We can make that. We can define you by that. That you are a really caring person. But how much have you been able to really get into policy? Have you been able to get some data and put it out there and get the people to, the government to, or the Supreme Court? There is this 500 people petition that has been put into the Supreme Court.
Sure.
Have you really supplemented all of this with some finding of yours which says that, we care and we say this?
Sure. Excellent, excellent question. Very pointed question. I'll try and give very specific answers. So, first of all, madam, if I was to name one contribution that I have done in this field, I would say that I have given a face to this problem. Earlier we used to
Okay.
talk, oh, air pollution
Mm-hmm.
affects lungs, this, that, this, that. By bringing
Mm-hmm.
those images from my operating room into the
Mm-hmm.
public space, and those images have been shown in lectures in WHO headquarters, United Nations
Okay.
headquarters, World Economic
Okay.
Forum websites, and
Mm-hmm.
everywhere. Even in my surgery lectures, I make it a point to at least once show that image of a pink lung and a black lung. So that,
Oh my
madam, has
God.
given a
Mm.
face to this problem.
Brilliant.
That this
Yes.
black
Yes.
lung, even the Director General of WHO, the environment program director of WHO, Dr. Maria Nera. Every time she makes a lecture, she makes it a point to talk about this image and present this image. So that's one, that there is a image, there is a face to the problem of air pollution, that it's blackening our lungs. That's very important for this problem to stick in the minds of people,
Minds.
because images stick more and faster than the
Better,
words.
faster.
So that's one
Correct.
that we have been able to do. Secondly, you talked about studies. Lung Care Foundation carried out a study of asthma in school children. In 2019, we did this study where we studied about 4,000 children across 35 schools in Delhi and compared their lung functions to their age-matched counterparts in Mysuru and uh, Kottayam in Kerala, Kottayam in Kerala, Mysuru in Bengal, in Karnataka.
Karnataka.
And we were astonished to find nearly 27% incidence of spirometry proved asthma amongst school children. And we reported this in a very prestigious journal called Lung India. It's already published. And I'm happy to report that this study was actually quoted by National Green Tribunal in two of their major decisions. So that's number one. Number two, a couple of years back, there was a case in Honorable Supreme Court regarding crackers and air pollution. And I had intervened there, and I had given these pink lung, blank lung images there. And this also was used by the honorable respected judge while giving this judgment. We have also given these images to a lot of members of parliament who have shown it inside the parliament that, look, this is what is happening. And I'm in the process of trying to reach Indian Medical Association, which has over 400,000 doctors across the country, 1,700 branches. And I'm trying to have it circulated to all these 4 lakh doctors across the country, those images, and a small PowerPoint presentation on how air pollution is a serious health emergency, or rather a health disaster. And the doctors have to talk about it to the people. The reason why it's not getting attention, you'll be shocked, madam, to know that every year air pollution kills more people than COVID did in its entire epidemic. But
really?
Yes, every year air pollution kills more people than COVID did in its entire epidemic. But air pollution does not get even 1,000th of the attention which COVID brought the world to a halt. And air pollution, the life goes on. Why? The reason is that when COVID struck, people died within few days. It was visible. Cause, effect. Cause, effect. Air pollution, on the other hand, is a slow poison. It kills you slowly, and it kills you by causing a host of diseases from brain to toe. And when you die or you become sick, you are diagnosed with that disease. But nowhere is it mentioned that that disease occurred because of the exposure to air pollution. So one of the things which we as doctors for clean air are now trying to convince our doctors is that every time they diagnose an asthma, they write asthma due to exposure to air pollution.
Correct.
I would share
that
my
is so important.
I am a chest surgeon, so I treat lung cancer. In 1988, 95% of my lung cancer patients were smokers. And today, more than 50% of my patients are so-called non-smokers. So-called non-smokers. So from 95, 50, huge change in just about 35 years because they are getting exposed to air pollution. So every time I diagnose lung cancer, when the family asks me, oh, Doctor, I have never smoked. Why have I got lung cancer? I talk to them about air pollution for 15 minutes. I take time, I open my laptop and I show those images to them that at least this one family it will be convinced and will talk to the other people in that area. So I'm now trying that if 400,000 doctors across the country can be talking about each of these diseases somewhere or the other being linked to
Mm-hmm.
pollution, it will
Mm.
reach the information to 140 crore people. Because despite so much of media attention, as a doctor who's
Yeah.
traveled across the country talking about this issue, there is very little lack of understanding of the magnitude of problem,
Yes.
gravity of the problem.
Yes.
People know,
Yes.
yeah, air
Absolutely.
pollution affect
Absolutely.
karta hai, but they don't know
Bilkul. Bilkul.
how badly it impacts them. And unless
How
they know the
terrible.
gravity, the depth of the problem, the magnitude of the problem, their
Hmm.
response will be, "Ha, theek hai, dekhenge, dekhenge. Government has to
Yeah.
solve
We'll
it."
see. We'll
If they
see.
are told that their son's lunchbox has some poison, they would run and snatch away their lunchbox and not let the child
Hmm.
eat. But when they
Hmm.
are told that the air which their son is breathing has poison, they don't respond because
But so it's also a certain amount of helplessness. I mean, what can one do? I mean, if you are, you know where the problem is,
you can
but
you can
you
at
know your
least
livelihood
demand
is also there.
if
Yeah.
140
That.
crore people say that we don't want any reveries, we want clean air, it is our basic human right. You can live without food for 21 days, you can live without water for 5 days, you cannot live without air for more than 2 minutes.
Correct.
It's more precious than food
Yeah.
and water and house and car
It
and
is.
jewelry
It
and
is.
other things. But we are not
Absolutely.
asking for it. My job as a
Yeah.
doctor is to create this awareness where 140 crore people start asking for this as a right in preference to everything else in the world. It's more important
Hmm.
than money and other things.
Okay, doctor. Now you've led me to one small additional question, which is which we are exceeding time. I know Dr. Sumiti is going to let us just talk about the fact that you said that the cause of death or the cause of disease um, in the doctors, what you have been, the people you've been talking with, you want them to write that this is non-smoker, that NS, I think it's, there is a term for it, NS, NS, I forget.
Yeah, whatever.
But so this, isn't it possible to remodel textbooks or remodel the syllabus, or to add air pollution as one of the, so when you do medical learning in your say MBBS or MD, whichever section, isn't it possible to remodel things and add that air pollution is an important, so have you been able to talk about that, or
Yeah,
add that?
so I'm addressing it at two levels. One is we've written to National Medical Commission, which
Mm-hmm.
actually and various state, health is a state subject, so it's governed
Yes.
in each state. So each state has a
Mm-hmm.
state health university. We have written to most of the state health universities and also to National Medical Commission that there should be a big chapter on air
Yes.
pollution and its health effects for in the MBBS curriculum. Number one.
In
Number
the
two,
MBBS.
there is a
Mm-hmm.
group called Medical Students Network of India, MSN, Medical Students Network. They have
Mm-hmm.
more than 30, 40,000 medical students across the country as their members. And we've reached out to them. So there is one Professor Shalabh Gupta in Santosh Medical College in Ghaziabad, who's the convener. And through him, we've
Okay.
done numerous Zoom programs for medical students, apprising them of this problem and requesting them to become messengers for discussing this topic in their medical colleges with their seniors, juniors, peers, patients, all of them. So we are working on this and
Yeah,
it will.
fantastic. I mean, yes, that's. I mean, we've kind of opened little areas where we can really take this discussion. And
Sure.
Doctor, I would say that it's exemplary that we've got to meet somebody like you, and your achievements. But how responsive? This is my last and final question to you. I'm sorry, I'm taking up all of your time today. This is the last question. That how responsive do you think you find doctors around you to what should I say, like the medical profession has changed also. It has become more commercial than it was before. And we do find, what should I say, a kind of a trust deficit. And we do this doctor shopping. I mean, we go from one to the other, because we really can't rely on one person's opinion. And we hear about stories where pharmacies push drugs which are probably not good for you and stuff like that, because, all kinds of, stories come, like diabetes and hypertension, and how these the number at which you become a diabetic and the number at which you are hypertensive, they keep changing. So, because it benefits, perhaps. These are all conjectures and stories and maybe have some basis for truth. But tell us, doctor, you have chosen a path which is very different from what we are seeing most of India's doctors to be. One, why is it so personal for you? And two, how do you convince others to join you?
That's a very, very difficult to answer question, but I would answer it. So I think I would say seeing is believing, and nothing hurts more than seeing something with your own eyes. Uh,
Mhm.
25 years back, I was not an activist in this field. Why did I?
You're not an
Why that?
activist.
Why did I get into? Why did I create Lung Care Foundation? Because I was so disturbed by seeing those images of teenagers, not images, the
Hmm.
teenagers, black deposits in lungs, series
Yeah,
of
yeah.
teenagers and black. I said, my God, what is this happening? And you know, can how can I remain quiet and not talk to
Hmm.
people? Was the thing on my mind. I said, no, as a doctor, it's my duty to get these images into public space, because no one else will have this solid picture to show
Yeah.
as to what is
Huh.
happening. You don't
Huh.
see this on the
Huh.
chest x-ray. You don't see this on the CT scan.
Hmm.
You only see it when you
Hmm.
open the
When
chest
you
and
open,
you with your eyes.
exactly.
And fortunately, we have
Hmm.
excellent recording systems today. So that was the defining moment that no, it's your duty. While you continue to treat, by treating,
Hmm.
you will benefit few thousand people in rest of your life. But by
Hmm.
preventing, you may
Hmm.
benefit millions of people in the rest of
Yes.
your life. So that was the answer which came from inside, that my purpose
Hmm.
is to help people, that I am helping more people by preventing diseases rather than just by treating.
Yes.
Although
Yes.
few
It's your
people told
calling.
me
Yeah.
that air
Hmm.
pollution is actually in your interest. More air pollution means gestation for
More
you.
patience.
So anyway, that
Yes,
was
of
in a
course.
lighter vein. So your second question was, how do I convince other people? I think,
Hmm.
of course, there are people who, when they are told this information, they become
Hmm.
very serious and are willing to devote a lot of time to this. And there are hundreds of doctors across the country who are doing it.
Hmm.
Others are not that much interested. But, madam, that's true
Hmm.
for anything and everything. That they will be very interested, less
Yes.
interested, not interested, disinterested. So that's fine.
Hmm.
But 100%
Hmm.
people need not get interested. Even if we have few hundred committed people across the country, I think that's a
Hmm.
good enough
Hmm.
number for us to create a momentum of
Hmm.
spreading this information. This pink lung, black lung image, which I'll share
Hmm.
with you later, needs to
Yes.
reach 140 crore people. Look, this
Hmm.
is what air pollution is causing to your lungs. Are you going to
Yes.
accept it? I'm sure everybody will
Hmm.
say no. From there, we'll start the action. I call it triple A approach. You make them aware, which will
Hmm.
awaken their mind to the dangers which looms ahead for them. And when they are
Hmm.
awakened, they will be going into action mode. And actions will be of two
Okay.
types. One, things which they can do at a small level,
Hmm.
and more
Hmm.
important, things which government can do, which they need to accept. But oftentimes the government doesn't do it because of the fear of non acceptance from people. but the acceptance will come when they are aware of the dangers. So this
Yes,
is
so,
how
so
I propose to
doctor,
handle it.
so you said you start with aware, then awaken, and then
Awareness
act,
leads to awakening. Awakening
and
leads
then
to actions by
action.
them,
Yeah.
and
Hmm.
acceptance of actions by the government.
Yes, but the government doesn't bear air pollution in their manifestos even. So I don't know how much work we'll need to do to even include air pollution and pollution, in fact, in their manifestos and then get them to act on it. So, but yes, I believe you. I believe what you're doing, and I believe we must try. And thank you so much for your time, doctor. It was very, very. I mean, what would I say? Really, it's very heartwarming at the end of the day to find someone of your profession to be leading something in air pollution, because we find very few environmentalists as of now. But being a doctor and working in this field, we are delighted to meet you today, doctor, and hope to see you again in the future. Again, I'm sure there'll be more things coming up, and with your kind of ideas, uh, we'll we'll have some change and some
Well,
really, really
I
solid
also would
change.
like to thank you for this opportunity. I must say your questions were very, very focused, pointed, pertinent, and I enjoyed answering those questions because they are related to the lives of day-to-day people and how air pollution is impacting them. And I'm sure your podcast will prove to be extremely useful to your viewers. Thank you so much for the opportunity.
Thank you,
And let's
doctor.
all
Thank you.
collectively hope that tomorrow we breathe cleaner air.
Yes, sir.
Thank you.
Amen to that. Thank you,
Amen.
doctor. Dr. Sumiti, now if you can just perhaps close the podcast for us.
Thank you once again, Dr. Arvind, for your incredible work in this field. And to our listeners, thank you for joining us today on the second episode on the Air We Fear series. Don't forget to share it with others. Clean air is not just a privilege but a right, and we all have a role to play in achieving it. This is Geography and You Live. I'm your host, Dr. Sumiti. Until next time.